carpal is just a hollow because from here the second row, it is just a technique of the extra advantage.
I totally agree with you, but at the same time, if you are doing it, it's a little bit maneuvering of the thread. You need to understand when you are putting the thread, it's subcutaneous, and if you just slightly lift the skin or hold it in there, and if, with the passage of time, what you are saying is perfectly fine for the beginners, do it like this, but as you go, do more and more, you will be able to maneuver that. So yes, I agree with you.
So it is, now we are going for local anesthesia.
Just a quick, I'm just going to take over just for a few minutes and give it back. When we pop local anesthesia, we pop local anesthesia as a point of entry and point of exits. I do it with local anesthesia, adrenaline with lidocaine with adrenaline or epinephrine, because I want the bleeding to be controlled as well. Now, whenever you're working the mid-face, you never go at 90 degrees, you go at 45 degrees or 30 degrees. You want to see the white patch. Now, the reason I'm not going here, and this happened a couple of weeks ago, I was giving a workshop in Jordan, one of the doctors decided to go at 90 degrees, even she was told not to. What happened was the patient ended up with facial weakness because that was a facial nerve. It's not the end of the world. It's going to last for about 2 hours and go away. But the patient's going to freak out. And anything that's going to happen to that part of the face for the next 10 years, they're going to blame you for it. So just make sure you stay superficial in those areas. Now, the last thing is I want to comment on here with giving local anesthesia before handing over the mic back, is because I've placed the points of exit in one area here, I don't have to inject 3 times. Local anesthesia is uncomfortable. So what I do is I'm just going to go in and just give a nice bubble and lift it. So one area where you can see now, it kind of swell up a little bit, and I have a little bubble that will make it easier for the needle to go up. Back to you.
So you are not going to give local anesthesia on full track?
I will not give local anesthesia on full track.
Yes.
And there's a reason behind it.
Yes, please.
Because pain to me is an indication, number one. If I'm in the wrong track, the patient's going to tell me she's in pain, and I know I'm either too superficial or too deep. So I'm going to stop straight away. Number two, if I give the full track, sometimes the local anesthesia might dissect the wrong plane, and the patient wouldn't know. So if I go in with a cannula and I give the full track, I'm not sure if my cannula is in the sub-Q level. Is it too superficial or is it too deep? And the pain is going to be numb. But I might end up placing my silhouette soft in a plane that should not be there without me knowing, because it's just easy. The local anesthesia has spread it up, has split it up, and the patient won't be able to tell me that I'm in the wrong plane because she's not feeling any pain. So that's why it's only the entry and exit first.
Dr. Mayu, you give full tunnel anesthesia or just entry exit?
For silhouette, you actually do not need the full track. It's a very thin needle, everything is, it's just like giving a filler injection in the subcutaneous tissue. So the only painful part is the entry point, and sometimes they feel a little discomfort when the corks are, going through it and it's having those click sounds. That's the only thing. Otherwise, I totally agree, you don't need it. I actually don't even give the local anesthesia to the exit point. It's just a quick thing and you're through it.
Okay. Let's try this time. Because I think local anesthesia is quite painful.
Maybe we could talk about thread complications and how
Yes.
to avoid them. What are your thoughts? What is the most complication you guys worry about? Hematoma, okay, that's a good one. So hematoma, usually, most commonly, it happens in the temporal area by hitting the superficial temporal artery. Unfortunately, we don't have X-ray eyes, and we'll never be able to decide if there's, to know where that superficial temporal artery is. It varies a lot. Is it to front, is it to back, is it to middle? With aging, how much If you go through the superficial temporal artery, you go through the superficial temporal artery. It's not the end of the world. You deal with it the same way you deal with any hematoma. You put some pressure, cold pass, and it will be fine. That's not a problem. Don't stress, don't panic. Now, what worries me more, I was with Franco, you know Franco? So I was giving a talk with Franco, and we got a question saying, when you're in the mid-phase, what will you do if you go through the parotid duct? Okay? Now, Franco is not as diplomatic as I am. He's Italian, he's an angry Italian, he's always shouting. So his response was, if you go through the parotid duct, you should give your medical degree back. Because if you go that deep, you went through the SMAS, the superficial parotid gland, the deep parotid lobe, into the duct, patient's head is hitting the wall because of pain, and you still carry on, then there's something going wrong with you. It's not the technique, it's not the thread. And you have to treat it in a surgical way. The bottom line is keep an eye on what you're doing. Listen to your patient. Make sure you know which plane you are, regardless of how much experience you have.
And what about entrapment of nerves?
Right, entrapment of nerves. I hear a lot of complaints where a bit of sensitivity, tingling sensation, electric sensation, the first week to sometimes a month after. And what I find my explanation of it is when you place your silhouette soft, you're going to end up with edema and you're going to end up with fibrous tissue. And when that does happen, when you end up with edema and fibrous tissue, that pressure or that swelling that might hit the nerve and makes it more sensitive. But this will go. It will go with time. Once the edema relaxes, it will go. The body works in a fantastic way where it repairs and heals itself. So there's nothing to panic about. Research has been done about this product. It's been there for years and years and years. I think they did over 500 cases. None of them had serious, permanent complications following placing of the thread, if it was done the right way.
Right. And what about infections?
Well, infections. We've talked about that earlier. It is something that should be done in a sterilized environment, and that's why we're given local anesthesia. Now I'm going to use the betadine. The question, the $1 million question is, do you give antibiotics after the procedure or do you not give antibiotics after the procedure? Now,
I regularly give.
you regularly give. I completely understand that. Now, the thing is, it's all about the schooling and what you believe in. I'm an NHS boy. I worked with the NHS in the UK, and over there they give antibiotics when someone's borderline dying. Other than that, they don't. So I stick to that. It's not wrong to give antibiotics. It's just whether I'm not here to say what's right and what's wrong. If you're a believer of prophylactic antibiotics, then by all means give it. If you're not, then don't. It's a clean procedure. My panfacial fractures, I give one dose of antibiotics on induction in GA and that's it. I don't even send them home with antibiotics. But that's because this is what I've learned. This is what my boss taught me. But in Saudi Arabia, it is considered negligent if a patient walks into your clinic and you don't send them home with a course of antibiotics, regardless of what the reason is. So it just depends. Good, yeah? Perfect, yeah. Okay, let's have a look at the camera. Okay, so we start off with our 18 gauge needle. And I go in with my entry point, give it a nice twist, leave it there. The thread, so can you come and put the thread there, come and zoom out just to show them the thread here. So this is how the thread box come in. It's a pack. The pack has two. I'm going to start off by taking this off. Now I have the thread. This is an 8 cone.
This is it?
This is 12.
Okay.
I'm going to use the 12 to the net, but I need 3 pairs of 8s.
You know, Ravi, when you were saying what do you worry about and the complications, my biggest fear is infection. You are introducing a foreign body. If you people are not careful with the sterilization process and you leave an infection over there, for as long as thread is there, you can't care that infection. You have to be very, very careful whenever you are doing threadless.
Yes. It has to be in a very sterilized condition. So before we place the threads in, we hold. If we have a look at those are the cones. I stretch them for the knots to go tighter. It depends on what you're used to. I'm used to holding both threads together. Goes up. Here. And have scissors ready. Now, I place it in, and it goes straight at 90 degrees. Once it goes straight at 90 degrees, the black band is on the tip of the needle is the sub-Q level. I twist it and slowly push it in the sub-Q level. Regardless of how many you've been doing it, always check the tip of the needle. This plane is usually harder than the other planes because this is a curved plane, unlike the others just go straight. So what I do is, I create my straight plane by pulling the lip out. Keep checking where I am. Once I know that I've reached my exit point, I go back to my needle cover, protect any needle stick injuries, go out. Before going completely out, I pull it up, make sure nothing irregular, carry on, and slowly pull. And that's my first part done. I keep this thread that I've cut next to me. And what I'm going to do now is I'm going to do the other part, which is the anchoring part. I'm going to stretch, press it in, the same hold, pull it back. Now, as I said, this is a tricky part where you want to avoid the superficial temporal artery. So therefore what I do is I pull the whole track up, slowly push it. Now I've reached the point I want it to go out. I use the same entry point. Any pain there? No? Make sure there's no knot being created here. And that's my first thread done.
Do you want to keep it?
I gave her a needle stick injury yesterday. I don't want to do it again today. Again, doing the same thing.
So this whole procedure should be absolutely painless, right?
It should be painless. The local anesthesia is going to be a little uncomfortable.
Only the entry point, if you put it on the whole line, then you will never know if that and the muscle is in touch with your body.
But
Touch करेगा तो
if I do go deep or superficial,
the patient will stop.
the patient will stop straight away.
So the safety is not for anesthesia.
And the fact that you're, as Dr. Nayan said, I'm using a needle here, I'm not using a cannula, so it's not that uncomfortable for the patient. Because it's not blunt dissection, it's just cutting straight through the tissue. But again, this could be a little bit, if you go through the wrong plane, you can easily injure vital anatomy structures.
And Dr. Umar doesn't even want to anesthetize the entry exit point also.
And I see why you would say that, and to be honest, it makes a lot of sense. Now he said it, I'm probably going to do
Even
the
after
exact same
the
thing.
drawing after the next two patients.
No, because you know, the patient's going to feel
Just a needle.
a needle, anyways. But when I'm giving local anesthesia, it's going to be stinky. It's not only going to be painful, it's going to be.
And when you're pulling it, does it even feel any pain? It's still not. I'll try it. I was only worried about the entry exit routes.
So yeah,
Even the entry point is only because of the 18 gauge needle that you are putting in and you are making that small metal tunnel. Otherwise, technically speaking, you don't need it. It's a very fine needle. It's probably less than 27 gauge needle.
Yeah, I think
It's probably, if I'm not, it should be around 29 gauge.
no, it is not this one. Maybe it is. Let's.
This thread,
Needle is,
you can
Can you give me a
thread
pouch?
this thread through the needle of
You
27
want the
gauge.
pouch
to see the size of needle.
you want it the size of the needle?
Yeah, it's written over here. It's I think 23 gauge of the needle. What is 21? No, it's written over there.
Ah.
I had these threads on my face and it was so painless that yesterday morning I forgot that I had threads and I scrubbed my face and then I realized, oh my god, this is not logical. Is that me?
where did you have it done? Where did you have it done?
Once it was after the workshop in Karachi, some couple of years back. Mom had come
Yeah.
and then she had done it for me. She came back to my clinic. She did it for me in my clinic because I was very paranoid about it. And it's the sterilization. I'm not comfortable. It has to be done all threads with absolute sterile technique. It doesn't matter what you do. I even use surgical gloves sometimes to put fillers in the cannula. I know it's silly, but I'm super paranoid about protection.
You are right. Not fully.
Right. So last thread in the face going now. And then I'm going to do the neck. Following the neck, I'm going to reposition the right side before doing the left side.
Ravi, my only concern is, you see, when you are measuring in the beginning and you are going beyond the nasolabial fold and you see that your last cone is in the middle over there, right? Now, of course, in the end, I don't know, I'll see in a minute, you always adjust the cones, right? You always push it. In my experience, if I am not about a centimeter behind or two behind the place which I want to lift, my cones can pass that area. And if mask that area, it can give me that dimpling effect, especially nasolabial board, because of the anatomy of fibrous tissue and muscles attaching over there. That's why it moves. So if I go beyond that thing, I can cause a little bit more dimpling over there.
I agree with you. Now here's the thing. When I first started doing threads, and I have 12 cone now. So there's an 8 cone in this pack, keep it on the side, and there's the one that we opened earlier. When I first started doing threads, when I used to get dimpling, I used to panic. Now when I get dimpling, I know that I'm doing the right thing. Because there's two types of dimpling. There's dimpling. There's dimpling when we're too superficial, and that's a problem. And that's something that's not going to go away. And that's the reason behind it is because it was done the wrong way. It's because of technique. But then there's the dimpling, which is Dr. Huma is talking about, when you overlift. And it's just physically, it's you're adding too much tissue at some point that you end up with the skin dimpling in that area. And to me, if that does happen, I could either relax it straight away, or even if I leave it, even though the patients will not be happy. I haven't had any cases where dimpling would last more than a week. Because the way the silhouette soft works and the cone's going backward and forward, it will find a way where it will relax and the skin will sort itself out in the mobile zone. That is when we overdo it, the dimpling, not when we're too superficial. So it does dissolve eventually, I find. What do you think?
You see, when you are adjusting it, the cones by that time is already in the distal part of the knot. It's already there.
Yes.
Right? So it's not going to readjust after that.
Even though the cone is moving, do you reckon? Even
The
though
cone is not supposed to move after that. No.
the cone moves the first.
Once you adjust it in the end, once you pull the thread,
Yeah.
already the cone is holding at the
Okay.
front one.
Okay. All right. I mean, I would have thought that the cones would still, the first 24 to 48 hours would move till it finds the right place. But maybe to avoid that, we don't have to. We could reposition gently. How would you avoid that? What would you do?
Sorry, say it again.
What would you do to avoid that?
You see, I normally do not cross this nasal area. I know.
Okay.
Because I want to pull the soft tissue, the fat,
Yeah.
behind that, and I want to push it further back.
Okay.
I'm not pulling the nasolabial fold, I'm pulling the soft tissue
Behind it.
behind that.
Yeah.
So if my cone passes it, then it will lose its purpose.
Right.
So that's my concept of doing it.
Yeah.
I don't know, over the period of time, you see the companies come up with new protocols. So maybe this is the new protocol.
I think that was the protocol before, wasn't it? We don't pass. Was that the protocol before?
Not that I'm aware of. I've done quite a few numbers of threads, still probably over 400-500 patients, but I've never crossed that line.
Yeah.
Dr. Mani, it was 23. It is 23. 23 days. The
Sorry?
results are 23 days.
Right. So we placed 4 threads now. So what we're going to do is going to gently reposition.
I think the only painful point was in the neck.
Look and see. And the reason it was painful because this area is a little bit too thin. So
And what are the chances that bones will be visible in this area?
if you do it the right way, they should not be. They should not be.
Okay. Because in some patients, skin over is very thin.
Then those are not the right patients for silhouette soft. Good skin quality, mild to moderate sagging. So I'm gently just.
And if they are visible too much superficially, is there any way that we can remove them?
If you see them before cutting them, then yeah, you pull it as a way, you cut it and remove the suture itself and discard it. But if there isn't a way, then, and you cut everything, then unfortunately no. So while I'm cleaning towards the entry point, okay? And then over here, towards the entry point. Now the repositioning part. The repositioning, you need to do it very, very, very gently. So you hold the thread, and as a rule of thumb, if I have 4 threads here, 4 cones here, I'm going to place 1, 2, 3, 4. That's it. No pressure. Don't overdo it. Don't push it extra. Silhouette softening is about being slick. 1, 2, 3, 4. 1, 2, 3, 4. But just massage it. Don't overdo it. Once you overdo it, you will 100% end up with dimpling. You're just sliding it over those cones. That's all you need to do. And then the same goes. Any pain there? You okay? Yeah? So we're slowly going to move to the camera to the front because I'm going to sit her at the front so if we could get the camera ready just exactly in front of us. Now I'm doing the neck. Very gently. Now I've repositioned this area. What I'm going to do is I want to anchor. So this part here, I'm going to push. I'm anchoring here. So all I'm doing. Same goes here. Doing it an anchor. Right, so we're going to slowly sit her up. Zoom out, please. Very gently. Get up.
Excellent.
Yeah. Okay. Now, what I want you to do is do this. And is there a way? Actually, wait.
Excellent.
Yeah.
But the problem is that if again we talk about finances, so it means that cost is almost 200,000
What's
without
that in dollars?
in dollars.
1,300.
For threads?
Yeah,
For
just the cost.
The cost on you or the cost for the patient?
No, cost of us.
yes.
How much did you say again?
4 threads?
A box of 5 comes for almost 1,300.
So speak to them about price on me.
See, Harun, my point is,
Where's the big box?
when you are doing these procedures, you don't worry about the cost. You worry about the quality of results. So, if you have patients who are price conscious, you can always use other things which can give you a results, maybe a little less, maybe a little bit more, but you can. But if you want to sell something which is good, I don't worry about the price.
Right, head back.
No, just
It's expensive everything. I mean, silver is also expensive everything.
because it will last for I think 1 year or maybe
Can you hold this and take some
maybe
video
1.5
for the
years.
just like this?
Or still she will be needing fillers.
That's when he's doing
Ask
it.
Ravi how much he charges for one silver patient. Someone like Ravi, how much would you charge it to Ravi?
Okay, so imagine it.
In your
Okay, with discount or without discount?
No, just what you charge. On
With
average.
discount.
Average what you charge.
Okay.
Be careful what you wish for.
Much better.
$4,000.
$4,000.
Yeah, $4,000. It's not cheap procedure. $4,000 for this patient right?
No,
So-
how much Dr. Rami charges is the buy.
So how many of you would charge $4,000, which is equivalent to almost touching 700,000 rupees or 650,000 rupees? No one, right? Now, if the cost is 200,000, most of us will charge another 100,000 on top of that or 50,000 on top of that for a procedure that takes half an hour. It's very fair. It's very fair.
Dr. Humayun, how much do you charge for surgical fees? Please.
In Pakistan, on an average, in Pakistan, on an average, $4,000 is what I charge for a facelift,
$4,000?
which is 650,000.
We'll have an
But that's inclusive of upper lower blepharoplasty.
No, just facelift.
No, facelift comes with
This is
just the facelift will be something like 600,000.
Any doctors would like to put some steroid drugs and come and help me?
Do you want to try?
yeah.
No, it's a you. No one wants to come and give me a hand? Second to eighth, please, can we open another pack? Second eight, please.
किधर है किधर?
Oh, you want to do it? Oh, okay. There you go.
Go ahead, go ahead. No. Which what?
Right, here's my advice, okay? Silhouette soft is not a cheap procedure. I completely and 100% agree with that, especially after knowing the numbers. But would you guys pay for an LV bag? What are your thoughts on that? I'm just thinking, maybe the way you want to market Silhouette Soft is branded in your clinic. That's maybe one way of doing it. All about brands, yeah? Sorry? This is the LV of friends.
I agree. it's not comparable.
Say that again. Say that again.
No, this is for sure. That no threat, because I have used all the fogs, Epton and silver. In my opinion, this is the best.
I should not agree more.
Is there any chance of uneven?
It's a very good question. You want to say that question so Rami can answer?
I think, Rami?
Okay. So there was a question.
Irregularity. It's a complication. Tell us about irregularity.
I think it's physically impossible. And then we both study evidence-based medicine to have asymmetry. This is what we question, right? Asymmetry to start off. No one has the right side of the face exactly like the left side. No one. However, I never think that silhouette soft will fix asymmetry. But we are not the fact. If you end up with asymmetry if you use 2 threads on one side and 3 threads on the other side. But at the end of the day, when you're using it the right way and you're placing it in the right plane, research has shown no, we don't.
But I think the best thing is that whenever you are doing any procedure, always point out asymmetry to the patient.
Yes, take
That
photos.
and record it with a photograph. Yeah, because sometimes patients will say immediately, look, you have distorted my face. But if you have evidence that look, or you point it out before doing this procedure. But you can create the symmetry, like if there is a gross asymmetry, you can put 3 threads on one side and maybe 5 on the other side. Yeah, so there is no problem with it.
I haven't? Okay, so I'm going to go back to the bar without doing that. Don't worry, we'll make sure everything is correct.
Yes. You had,
She's focusing.
yes.
There's a helmet. Thank you very much. I'm going to create a benefit for teaching purposes to show them what to do. Is that okay?
Don't worry, he's going to resolve it. He won't let you go.
So here's the dimple, guys. Let's focus a little bit. So I'm over now. This is what I'm going to create a dimple intention. So a dimple would happen when you overdo it. Does it show? Yeah? So what do we do? If you don't want to send the patient, but I promise you, even if you send the patient like that, it will resolve. I promise. But even if you don't want to send it, all you need to do is relax it, push it back, and the dimple is gone. So because you overload the tissue, okay? Oh my God. The bottom line is, when you're doing silhouette, if you're doing silhouette, the secret of it is be gentle. Don't put too much pressure. Just you need to be very gentle, alright?
Is it
So let's sit her up again and have a look at the final look we have. Yeah?
News about
Right. Whenever you're removing the rest of the stitch, it's very important to count. What we do is we hold the thread, we push the skin inside, we cut and relax it. Hold it up, push it inside, cut and relax. In the hairline, you can easily confuse it with the white hair. So make sure you're cutting the thread itself. Otherwise, the patient will come in the next day saying, while I was showering, I felt the thread, and it has happened before. So, in my practice, I make everyone in the room count. My nurse, my team, so everyone knows that we did the right count.
I know you're amazed.
Actually, in all conferences, we are only given 2 p.m. This is the first time that we are doing the live demo with the 4.
Thank you.